One of the things that is most critical to living with any rare disease, but especially a bleeding disorder. My name is Jonathan James. I'm the president and CEO of Hope Charities, and it is great to be with you today. I want to talk to you just for a few minutes about an upcoming patient education event that we have that I'm super excited about called Profi Conference, where we're going to be talking about exactly this. How do you stay consistent in life when life gets in the way? One of the challenges of so many of us living with a rare disease that requires intravenous medications, especially, is that you have to be consistent or else it doesn't serve the purpose long term that it could. It could put you at risk for joint disease. It can put you at risk for even life-threatening circumstances if you were to get into some sort of crisis. And so it's so important that we stay faithful and we stay consistent. You know, I have 4 kids, and one of the challenges that I run into is raising kids is I couldn't hardly get my kids to brush their teeth every day some days, and it much less get them to encourage them to stick themselves with a needle in the arm. It's just hard sometimes, and we understand that. And so this event is really to talk about what can we do to inspire ourselves, encourage ourselves to stay consistent. So I want you to join me for this amazing live online educational event. You can join from anywhere, your phone, your tablet, your PC, and all you have to do is go right to our website at hope-charities.org. You can register right there on the homepage, and you'll learn all about it. We're going to have a ton of fun together, giveaways, prizes, raffles, and great speakers, some amazing sessions that we're going to be talking about all kinds of aspects of therapy. But the main thing is that you get a chance to meet other families living all over the country that are dealing with some of the same similar issues that you're dealing with every day, day in and day out. And I'm really excited to have this event and invite you to be a part of it with us. But you got to go register for this event. Today, one of the challenges that I'm thinking about a lot right now is the psychosocial aspect of how do you stay inspired when life gets hard. And I've invited a good friend of mine, Debbie De La Riva, to join me today to talk a little bit about the ins and outs of mental health as it pertains to how do we stay faithful and consistent with these things. Debbie, it is great to see you. Thanks so much for joining me for this pre-event podcast today.
It is always awesome to share the screen with you. I wish I could be with you personally. Thank you for
Uh,
inviting me to
it's
share
always
the
good to get a hug through the video screen, even if we can't be in person. And that's one of the things I think is so interesting about these moments. And one of the things that I think the global pandemic sort of taught all of us is maybe how to use these types of technology to get together more often. And it makes a lot of sense for rare disease because you may live your whole life and never meet another person living with a bleeding disorder in your own hometown, but we can connect like this virtually many miles away.
Absolutely.
And it's always great to be with you. So thanks so much for being here.
Absolutely. Wouldn't miss it.
Well, I know you have just a depth of background in mental health as a licensed counselor. You also have been living with bleeding disorders and raising kids with bleeding disorders. So, for people maybe that are tuning in that haven't had a chance to get to know you as well as I have, I'd love for you to share just a little bit about where you're from, what your background is, and how you've been affected by bleeding disorders.
Oh my goodness, absolutely. Well, I got into this journey with my son 29 years ago, born with severe hemophilia A, and just been really, really active. The whole family has been. My daughter got to be in the NHFs at that time, NYLI. My husband was on the board of directors, and I was lucky enough to be a chapter leader. So we have been in it for a very, very long time.
Yeah.
And it's funny that you have chosen me to talk about Profi because I want to let you know something. We're really good friends, but you might not even know about Profi in my family from the beginning. And just wanted to go ahead and tell you about
Yeah.
it now.
Yeah, sure. Yeah, please.
And also, this will tell you how old I am because back in the mid '90s, you've probably heard about it, Jonathan. It was the Bear Joint Outcome Study. And
Mm,
my son was one of the 65 young boys or toddlers at the time, pups, that was in this trial, to prove the outcome that Profi is the best for. It's the gold standard for hemophilia A.
wow.
And there was two arms of it. One was for Profi and one was for on demand. And Jonathan, the day that the researcher told me that we were on the on demand, I remember that feeling in my stomach. I just kind of sunk back in my chair because I was saddened. I wanted the doctor to say, "No, you're going to start Profi now," because I knew what it meant to live, with on demand. It was just so unpredictable and
Yeah.
frightening.
Yeah, and really unnecessary risk. I mean, I think about even, prophy wasn't something that was really encouraged when I was
Yeah,
born, and of course, I mean, we didn't really have treatment at all at first, and then of course later on, even after treatment, it was so scarce and difficult to get because of all of the blood supply,
right.
sort of limitations, and even the challenges that came through all of the crisis during the 90s. But I would say that even the one of the things that we've seen so much is there's so much more available now, but people are still having difficulty. And I know for me, having a lot of joint damage as a child, and then even as a young adult, I
Hmm.
don't think I started prophylaxis. I hate to talk about dating yourself. This is not something I'm proud of necessarily, but I remember the doctors actually starting to encourage prophy when I was probably in college, and then but I didn't really commit to it because it's hard to teach an old dog new tricks or even a
Right.
young dog new tricks sometimes. But I didn't even start until I was maybe 25, and so I lived really my whole even into young adulthood without any preventative treatment, and I suffered tremendously as a result of that. But also the risk. I was in car accidents. I was in all kinds of
Well,
things
I
that
didn't know that.
really put myself at risk that could have been avoided and could have prevented joint damage had I been on prophy early.
Yeah.
And so sometimes even just knowing that that's good is not enough to convince us to commit to it. How did you navigate that with your son in terms of even you wanting it, but then also committing to it later?
Sure, sure. I mean, after the study was over, of course, it jumped straight to prophy because I knew intuitively that was the way to go. But
Right.
Jonathan, we were the lucky ones. We
Mhm.
live in Houston, a metropolitan city. We had home health care, and he had good vein access. I mean, we just kind of had all the things that we needed.
Wow.
And, and you talk about the mental health, the stress of this condition on families. I would hear and have a chance to talk to people that they lived in a rural place where there wasn't access, or
Mm,
their kids didn't have good venous access. The other thing was just the pure trauma of
mm,
knowing that you at that time be sticking your kid, in some layman's term, be infusing 3 times a week, and that whole idea just seemed so overwhelming and painful, to be honest with you.
mhm, mhm. I know for me, I was a hard stick as a child, and that was one of the things that was really I have a lot of kind of memories of trauma as a child that of being kind of held down to a
Yeah,
gurney in the middle of an emergency room and having to be in tremendous pain from a huge, fully metastasized bleed and getting stuck 6, 7, 8, 9, 10 times. I think the most I was ever stuck
yeah.
in one time was 11 times, but I was a very difficult stick.
But
And
you remember.
I remember, yeah. And so when we talk about mental health, that's something I think about. There's a lot of trauma that can come across from just the treatment, not only the bleeds or the incidences that can occur, from the diagnosis itself. And so how did you navigate that for yourself as a caregiver?
Well, it just there was this confidence knowing that there was a team of people behind me. I mean,
Mm,
even from the first time that I took over prophylaxis infusions, I physically had a nurse behind me, and she said, "You can do this because you have to."
mm,
And just there was just that finality, that clarity that this was the way to go, and we would do lots of things to help our son be more a part of it. We would have rituals involved with it, and it really really helped.
mm.
But
That's so good. Did you ever feel like you were, that you were doing, something that did you ever worry about the trauma that he may feel later in life because of what you were having to go through as in those early days?
yeah, of course, in that time, it was worry without any kind of knowledge or rational thought, and then nowadays, I get to talk to him as a young man, and ask him what that was like for him. and,
Mm,
and how that impacted not just the holding down. I mean, the whole idea of our what the difficulty we had, I feel, or more like I should say me, Jonathan, as a mother, was to release that bond of being the primary infuser, and that
yeah.
was a really really big deal.
Mm,
And then I found that after that, I kind of got lulled into this safety, this kind of false sense of safety that everything's going to be all right. And I really feel like I went too far back.
Mm,
And just like the stories that you and I hear about college students going, or not just college, just young adults just being, going on their way to adulthood, and how they take over it, and how that doesn't always work out because
mm,
I'm going to skip a dose or two, nothing will really happen,
mm,
or I am feel invincible because I have factor in me, so I'm going to go ahead and play that those ultimate frisbee games or whatever. So
mhm.
I think that's the big thing that I'm so glad you're having this conference because we need to talk openly about that and get proactive as opposed to reactive.
That's so good. Looking back on that, I'm just curious, is there anything that you feel like you would have done differently in the handoff for him taking his ownership? And I think life is a balancing act. So we don't
It is.
ever really there's not a right way, wrong way. I mean, like we're just doing our best, right? So, but I mean, like looking back over time, is there anything that you think that you would have done differently in that transaction between that transition point for him?
Absolutely. I wish I would have been able to step back and get out of the emotionality of it. I
Mm,
mean, I was so focused on giving him ownership and independence, I forgot the logical steps of how to. I
mm,
mean, things as simple as, hey, you're going to go to this university. You contact the HTC there, find out where the hospital is associated with them. It's drilled into us as parents
mhm,
to
mhm,
let go. It's the only way that they're going to learn how to fly. But
mhm,
I wish I would have stepped back and really thought about the logic of it and
mhm.
prepared him a little more.
Yeah. Well, there's such a fine balance for all of us as parents. Is like learning how. I often have said like, that I have four kids and two of them are girls that are also affected. And
Mhm.
one of the challenges that we've had, even in giving them infusions, has been, um, just navigating help. First of all, helping them understand that this is something they're going to live with, and then
Right.
accept it. I always think about like the stages of grief. I really believe that
Mm.
that's something that we all experience, and it kind of rotates through a lot of different things. And that's one of those things is like, first of all, maybe anger, you're maybe there's denial involved, and that's true when you get the early diagnosis as a parent
Right.
and your child can't remember those moments and they're super young, they're just an infant. But then maybe there's another whole framework of those stages that you have to also coach your child through when they're going through early adolescence and hearing they can't play football and
Right.
hearing they can't go through these things. Those stages of grief are real, and we have to coach them through that at every stage. And truly, as the parent, you're the most expert in their life, you're the most trusted in their life. And even
Mhm.
if they want to like push against it and rebel, like that doesn't mean that we shouldn't at least attempt to still be involved in their life and as they transition into complete ownership, don't
Right.
you think?
Absolutely so. And you said the word grief, and it really struck with me because we think we think of it as linear, the stages of grief. But um, my son recently went through another episode where he thought that you know he was managing hemophilia, it wasn't managing him, but yet a surprise happened, as it always does in our community, and then he had to re-grieve or talk about what it was like to feel kind of helpless at the moment, and
Mm,
what's that like for him now that he's already gotten his job and his stability, and it was just a big reminder that the big H is
still
still
there.
here.
Yeah, that's so hard. And I think as young adults, like we go through that, like I said before, I mean, I it really it takes a tribe, right? I mean, we're
Hmm.
we're we're all, we need each other. This is one of the reasons why I love moments like these conferences, is because it gives us an opportunity to connect in ways, to hear from other people's stories that really can help give us tips and tricks. It's not always what you hear from the presenter at the front of the room. Sometimes it's what you hear from the people sitting on the sides of you that help give
Right.
you that inspiration you need. And I just think it's so, 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 so important that we have this broad experience and connection with other families, because I know for me, like my wife played a big role in getting married and having to navigate that, and her learning how to coach me. Like it was almost better for me to hear, instead of hearing from my mom, who was also
Mhm.
a rock star, advocate for me and gave me all my infusions growing up and all of that. But it was almost better for me to transition into a role where I almost went through this place where I I wasn't doing very I wasn't making the best decisions for my own health, maybe in my 18, 19, 20 years
Right.
of age. But then meeting my wife, dating, getting married, all that stuff, is like I had to sort of introduce this. And so now I could be a teacher to her.
Mhm.
I could help her understand, and then my mom helping her and all of that too. It was like my health actually improved into my mid 20s, largely because I had a live-in cheerleader that was like, "Hey, we can do this together." And that played a unique role for me too. So it's like sort of going through that
Right.
transition of like self-ownership, and then still kind of failing at that, but then like having other new support, like put me in different places where maybe I wasn't really wanting to accept it myself fully, but by me being they always say the best way to learn something is to teach it. And I think that that's one of those things. It's like and one of the reasons why I love the community so much is because sometimes you need to be the one to give advice to somebody else so that you can actually start believing what you're preaching, if that makes sense, right?
Oh, absolutely. And as I was thinking about us having this conversation, I was thinking about possible solutions or places that we've got to make sure that we capture. And Hope does a very good job of this, because really, Jonathan, what needs to happen, I feel, two things, is the older people in our community may feel as if they're, I don't know, either forgotten or not useful or anything like that.
Yeah.
And I understand that. But boy, we need to keep that bridge. And so they can
So
let
true.
all these children know who've never had a bleed, or these
Mhm.
teens who don't want to infuse because it's get all mixed up in family dynamics, and just let them know that you guys are fortunate,
That's so true.
and this is what happens if you don't.
It's so much more like a family than it is like a university. I think sometimes like we kind of have this mindset of like I need to go to these conferences to learn so that I know the right information, and then once you feel like you've already learned everything, you go, I don't really need to be involved anymore. But
Right,
really, it's just that you change seats within the family. You don't really necessarily ever, maybe you're not going because you need to learn more. Maybe you're going because you need to offer some support to others and perspective. Like your perspective has a huge amount to do with your own mental health, right?
right, absolutely.
You can deal with the same set of problems, but just because you look at it from a different perspective, I can look at, oh, I need a new transmission. And I
Mhm.
look at my bank account and I go, that's terrible. And then, I'm devastated and feel this sense of loss and destruction almost. And like I have no worth because I can't afford to replace my transmission.
Right,
Or I can, once my transmission is like, I can look at this and go, oh, wait a minute, like I get a new transmission, I can get another 100,000 miles out of this car. I mean, that perspective change sometimes helps you to feel either hopeful or despair, but we need community in order to kind of make all of those perspective changes real for us, right?
yeah, I always love talking to you because I just get to, you really help me just have all kinds of ideas, and they get turned up, and they get out there again. And one of the things I wanted to say is that going to a conference because you have something to give, as opposed to something to be given. And I work a great deal now with Save One Life, and one of the things I want to do is promote the message of altruism, how
Mm,
that always has a positive impact on your mental wellness,
so true.
because you have something to give to someone else. And it's also a way for children who haven't had a bleed to focus out and to see
Yeah.
how they can help somebody else.
It's so true. The old adage that says that you don't really know what you have until you don't have it anymore. And sometimes focusing on people who are in more need or greater need
Mhm.
than you actually helps you have that perspective without having to experience the loss yourself. You can just look at somebody else's life and go, "Oh my gosh, like here's these people in these other countries that." I mean, I just was doing some research for World Hemophilia Day recently, showing that 70%, I think it is, of people living with bleeding disorders worldwide do not have access to regular treatment.
Right.
That's a phenomenal thing to think about I mean, I know I walked away from reading that just going, I feel blessed that I even have access, period. And I don't ever want to put shame on people, but it's
Right.
kind of like shame on me if I don't take advantage of it because I do have that access. And so it made me like sort of like improve my own health. And then simultaneously, it made me feel more positive about my future and my outlook because I realized, oh my gosh, there's people suffering. And while I want to help them, I also need to have gratitude for what I do have.
Hmm.
That gratitude is part of what makes us feel more inspired in life, right?
That's right, and hopefully you can take that to help someone else. And
Mm.
just like when I go to conferences or when my son goes to HTC, he's seen and heard, and there's a message that I have your back.
Yeah.
It's an amazing feeling to be able to do that for somebody else.
It's so true. It's so true. Well, I know with Profi Conference in particular, one of the things that we're talking about is that like how do you handle it when you feel depleted and you feel like you can't seem to get, you just feel disappointed with your life and you feel like you just don't want to go another day and life gets busy or hectic or whatever. That's one thing. But then there's other times where you're just like, I had a bleed and I was doing all the right things. What do you tell people that are really experiencing disappointment, maybe with their own behavior or disappointment, maybe with the drug not working like it was supposed to?
Right.
How do you help people get inspired to get re-engaged when they feel that like, is it even worthwhile for me to do this anymore? How do you?
Oh, absolutely. And there's a couple of things. We know it's can be really, really tempting to get into all or none. That I'm
Mm,
either doing it right or I'm doing it wrong, and that's the end of the story. And so, what I encourage people to do is not to not to give in to that feeling, but yet to accept it. It's a
mhm,
normal part of living with a chronic condition. That
mhm,
you're not always going to have the answers, and you're not always going to feel like you have what it takes to get through. And so when you accept it, it really helps you not shame yourself and get stuck in it.
mhm,
It's just a really different it's a different approach. And then of course, to reach out to other people, and
mhm.
you'll find that people, pillars of our community like Jonathan James, might have gone to that said same thing a
Yeah.
couple of weeks ago. What's the point? And
So true. I mean, I feel that even being as connected and involved and I mean, my whole life is about bringing inspiration to others and trying to solve some big problems. But I even feel that sometimes, and it's like, you know what? I often tell people like, that one of the things that really does help me regularly is going back to help somebody else that's in need. Like if I can go, if I get in my own head a little bit too much, like just going to help somebody else, like, and it doesn't have to always be hemophilia. It could just be going to volunteer at my church or going to get involved with
right,
this or that. It's like just somehow staying connected to humanity really gives me a perspective that's like important for me to go, you know what, there's more here than just this myopic thing I'm really angry about or focused on right now. And they always say if you feel in like you're in despair, you're feeling depression, like, hold the hand of a child, walk through the grass barefoot. It's those things. It's
right,
like get out in the sun. Like those might seem like really small steps, but I do think those are the things that make you go and say, being out in nature alone can sometimes just give you like, there's a whole big world out here that, really I need to refocus my attention on the bigger picture because sometimes that deep hole is
right.
it can lead you to a dark place that isn't healthy for you to stay in.
No, and it's usually future based. That
Mm,
this is where I'm at, and it's never going to get better. And I love what you said about finding ways to stay in the present.
hmm. I love that.
That's
I
the way
love
to do
that.
it.
Well, you are such an inspiration to me and such a bright light in our community, and I'm always so grateful for your help and input. And I know that people oftentimes talk about the hardships of going through this, and there's something about that authentic honesty that says, you know what, yeah, it's hard. It's it some days it's hard, and then locking arms and saying, but we're not going to stay here. It's that overly future, sometimes like,
Right.
um, where you feel like it's just never going to get better thing. But to me, every time I spend time with you and every time we get together, it's like I feel so inspired, and you give me a lot of this and behind me here. And
The
so I'm
feeling is
just so
so
grateful
mutual.
for you.
So you know that. You know that.
Yeah, well, thank you so much. And also I want to say a big thank you. I mean, many people may not know, but you also serve on our advisory council as an
Mhm.
important component to helping us make certain that we're keeping mental health as a primary thing. One of the things we do as an organization is we talk about, counseling, and we talk about encouraging people to stay open and connected and finding resources and all
Right.
of those things. And mental health is a huge piece to that puzzle. And I don't think it's just a part of something. I think it's a lot of something. It's probably, some days it's 100% of what we're going through. And so I just appreciate all the work that you do, but also your service to help us at Hope Charities and all the patients that we're trying to serve. And so thank you so much, Debbie, for all
Oh,
you
it's,
do.
it's my pleasure, and it's also such a no-brainer, Jonathan, because hope hope does exactly what you said with your mission. It's about hope and strength, and you treat the whole person.
Hmm.
So I want you to know that I'll always be. I always want to be a part of your organization as long as you have me.
Well, we will always have you if we can and get more of it. But just if people are watching, how can they get involved and learn more about this Profi conference?
Oh, yes. Well, it wouldn't take too long. All I have to do is go to your amazing website and click on events, and it's all there. And I really encourage everyone to participate.
Yeah, that's wonderful. Thank you so much. Well, it's great to see you as always. And I know you're actually about to go to a conference right now, so
I
I'll
am
let you
here
get
in
back to
Dallas.
it. But
Let's go.
but thanks so much for carving out time to be with us this morning. And I so appreciate you. And we'll be in touch, and let me know if there's anything that we can do for you. But thank you again for all that you do for us. We hope to see you very soon.
And thank you too.
Awesome. Talk to you soon.
Bye, friend.
I just want to say a big thank you to Debbie. She is such a inspiration to me personally and also to our whole community. She's been through so much and also been just a key voice in bringing hope really to people for a long time. And so big thank you to you, Debbie, for all that you do. And I'm really excited, as I mentioned before, about this conference coming up. It really would not be the same if you don't show up. So please go to our website and register. We need you there. We need your voice. We need to understand the challenges that you're having, because maybe we haven't thought about those challenges yet. Maybe other people are suffering and we haven't even thought about resources we should be building for that. So we need your voice in the mix of this. So it's going to be May 23rd, 22nd, and 23rd. It's a 2-day event. If you can only come to one session, that's okay. If you can come to all of them, even better. All you have to do is go right to the website, as Debbie mentioned, and register right there on the homepage. We're going to have tons of fun together. We're going to be giving gift cards and prizes, and generosity is my favorite. So we love to do giveaways. So we'll be doing lots of that. And if you have any questions or thoughts or comments, you can always email us at events@hope-charities.org. And but we would love to see you there, and hope that you can join us for this amazing time together to learn and grow together as a community, but also to hear some amazing sessions. We've got a full lineup of amazing speakers that are going to be talking about everything from PK studies and understanding how our levels are impacted over long periods of time. We'll be talking about some of the science behind protein replacement. We're going to be talking about all kinds of things, as well as the psychosocial aspect, like we talked about today. So please join us for this amazing event. Go register right now, and we hope to see you there. Thanks so much for joining me for this event podcast today. I look forward to seeing all